Hi, welcome to Skinsational's microneedling procedure with the skin pen. Nurse Amariah and myself are here to perform the microneedling procedure on Vanessa, our lovely patient. She's had microneedling before, so she's used to this. But we wanted to show it to you so y'all would kind of get an idea of what we're doing. The skin pen has lots of little micro needles that make little micro channels in the skin to allow stimulate blood flow, stimulate fibrin, elastin, and collagen production in the skin. It helps the skin obtain a more healthy, thicker, and resilient texture. We are going to use PRP on Vanessa, so Amariah will be drawing her blood. We have the centrifuge to spin and get the fibrin and the PRP out, and then Amariah will be putting it all over Vanessa's face after the microneedling, and it sinks into those little channels and helps stimulate the collagen and elastin production. So here we go. Okay, welcome back. Amariah is cleaning Vanessa's face, so it's okay to come to your microneedling procedure with makeup because we have everything we need to clean your face. This is a quick procedure. Even with the PRP and the numbing, you'll be out of here in 45 minutes for sure. So go ahead and you can come in the middle of the day, your lunch hour, whatever. So she's cleaning with makeup remover, and then she's going to clean with alcohol, and then we're going to put a warm towel on Vanessa's face just to open up those pores a little bit right before we put the numbing cream on, so that it soaks in really well and she's nice and numb for the procedure. So this is a topical numbing cream that comes with the skin pen. It's from Bellis Medical. It's a combination of 3 different topical anesthetics, and it works really, really well. We'll let it sit about 10 minutes. Okay, so we've got the topical numbing cream going on Vanessa. We're going to lift her chair up, and Amariah is going to draw her blood. Okay, so now Amariah is drawing Vanessa's blood. She's a registered nurse, so of course she knows how to do this. It's very comfortable. She did it on me, so it's worth it. After we draw the blood, we are putting it into a special test tube, and we're going to put it into the centrifuge, and the platelet-rich plasma will spin to the top of the tube. When Amariah is done with the microneedling procedure, she'll be rubbing the PRP right into Vanessa's newly microchanneled skin to help that elastin and collagen and blood flow. It does burn just a tad when she puts the PRP on, but it's not bad at all, and it's well worth it. Okay, so now Amariah is putting the blood draw into the centrifuge with the balancing tube, and we're going to let it spin about 10 minutes. Okay, Amariah is removing the numbing cream from Vanessa's face. Sorry about the noise. We have the blood spinning in the centrifuge, so I hope you guys can hear me okay. I want to go over what microneedling does. It improves the texture of the skin by stimulating blood flow, elastin, and collagen production. It reduces the appearance of acne scars, large pores, spider veins, sunspots, age spots, and really just gives the skin a nice, healthy, firm glow. We're going to use a cream called Lift that comes with skin pen, so hopefully we'll get just a little bit of lift in her skin. We do recommend, we sell the microneedling package of 3, 1 month apart. We prefer to do it 1 month apart. If you are already on a maintenance phase with microneedling, as Vanessa is, then we can do the single treatment option for you. We will give you the rest of the lift that we don't use during the procedure, and we also give you a calming or a rescue cream to put on at the end. And then for the next few days, you do need to stay out of the sun for 72 hours. And we are recommending our Zeo Skin products, and we will recommend the product that your skin requires at the time of treatment. So the centrifuge has stopped and we are going to open it and look and see how Vanessa's PRP formed. Wow, that looks great. We got plenty of PRP for Vanessa. This is plenty. So I'm just gonna put it over here until we're ready for it. Okay, so now we're starting the microneedling. The depth of the needles is dependent on the thickness of skin in different areas of the face. So on the forehead, we're going 0.25 only because the skin and the bone are just right up against each other. But as we go to her cheeks, we'll increase the depth because the dermis is thicker there. We're looking for the redness, indicating the circulation and the microchannels are being formed. So MRI is going in a very specific pattern to make sure we get every bit of the skin microchanneled. I did neglect to mention that with the procedure we do give you a complimentary mild cleanser from Zeo Skin just to help keep the skin nice and clean while the microchannels are still open. We don't want to introduce any bacteria into the skin at all, so we do recommend you use the cleanser that we give you. Okay, so now MRI is taking off the lift cream. You can see how Vanessa's face looks a little red, like she's been out in the sun. I think it was pretty comfortable for her. She didn't flinch. And now we're going to put the PRP on. Okay, so all we do is rub the PRP into the newly microchanneled skin. Okay, so that was our microneedling procedure with the skin pen. Vanessa did really well. Of course, Mariah did really well. Our nurse Jennifer also is certified to do this, and myself. So go to skinvip.me to schedule. Remember, we do give you the lift, the rescue calming cream, and the mild cleanser to keep your face clean. When you come for your appointment, we will do an assessment. We will look at special areas that we need to treat. Of course, you can always tell us all your concerns and we'll get those addressed. We do have the package of 3 or the individual. And then we do want to recommend to you a Zeo skincare product to help maintain your new healthy skin. We'll see you soon.